This video will demonstrate how to perform a flexibility test. Listed in this video are the 5 assessments that will measure flexibility. Flexibility is the ability to move a joint through its complete range of motion. The reason we assess this is to help determine any need for flexibility treatment or training programs to increase flexibility. The equipment you will need are a standard sit and reach box, a mat, chair, yardstick, ruler, and a goniometer. Have your subject start off with a 5 to 10 minute warm-up of moderate intensity, followed by light stretches. The first test that will be assessed is the Canadian Trunk Forward Flexion Test, also known as the Sit and Reach Test. This will test the hamstring's flexibility. Have the subject sit with back against the wall and take off their shoes. Once their shoes are off, have them place the feet flat against the sit and reach box at the 26 centimeter mark. However, this box is 3 centimeters off because the 0 point is set at 23 centimeters. The subject cannot have one hand lead the other, so make sure to have the subject's hand parallel or overlapping. Then have the subject push forward while exhaling and hold the position for 2 seconds. You will then repeat the test a second time and take the best measurement from the two. After this test, you will then classify your subject using the table shown. My subject had 41.3 centimeter reach after being subtracted from the measurement on the box. She is also between the ages of 20 and 29, therefore is classified as excellent. The next test is the YMCA Sit and Reach Test, which is the alternative for the box sit and reach. You will need a yardstick and a strip of tape that is 10 to 12 inches long. Place the yardstick on the mat with the tape across the 15-inch mark. Have the subject sit with back against the wall and the yardstick between the extended legs and feet at right angles. Make sure the heels of the feet touch the edge of the taped line. Subject will then exhale while reaching forward with hands far as possible. Have them hold the position for 2 seconds. Hands should be parallel and one does not lead the other. Repeat this procedure a second time and take the best measurement from the two. You will use this table to classify your subject and is measured in inches. The score of my subject was 24.5 inches and is between the ages of 18 to 25, therefore considered well above average at 90 percentile. The chair sit and reach test is a way of measuring hamstring flexibility for older individuals due to possible functional limitations. You will need a chair that has a 17-inch seat height and a ruler. Place the chair against the wall and have your subject sit on the front edge of the chair. Have subject extend one leg with ankle dorsiflexed, while the other leg is flexed on the sole of the foot is flat on the floor. Subject will then exhale while reaching down the extended leg, trying to touch their toes. They will hold this position for 2 seconds. When reaching for their toes, palms need to be faced down, hands parallel to each other, spine is straight, and head is in normal alignment. The way this is scored is by having the middle of the big toe be represented as 0 score. If the subject does not reach their toes, it is recorded as a negative number, and if they pass their toe, it is a positive number. Repeat this procedure with the opposite leg. The straight leg raise test. This test assesses flexibility of the hip extensors. You will need a mat and a goniometer. Have your subject lie on the floor on their back. Raise one of the subject's legs and push forward to get a good stretch, while ensuring the other leg remains extended and flat on the mat. You will then measure the angle of the flexion. You will use the goniometer by placing its axis on the greater trochanter. The desired angle of the subject should have is 90 degrees. If it is at an 80 degrees, it is acceptable, and past 90 degrees is also acceptable. Anything under 80 degrees is unacceptable. Once you obtain the measurement, you will record the angle and determine whether the range of motion is acceptable or unacceptable. Once this is done, you will repeat this procedure with the opposite leg. The last test will be the Thomas test. This test assesses the flexibility of the hip flexors. You will need a mat. Have your subject lay on the mat in a supine position. You will then have the subject bring one leg in the direction of their chest while hugging the leg just to the point where the lumbar spine is snug to the mat. The way this is scored is if the leg that is being tested remains in contact with the mat while lifting the other leg, the subject is considered flexible. If the test leg rises and is not in contact with the mat, the subject is unflexible. Once you record this measurement, you will repeat this procedure with the opposite leg. This concludes how to perform a flexibility assessment.